Hello, students. Good afternoon. Welcome to An Academy. How are you all? Very good afternoon to all of you. Hi, Pingu. Good afternoon. Good noon. Okay. Hi, Shubham. Very good afternoon. कैसे हैं मैम? मैं बिल्कुल ठीक हूँ बेटा. आप कैसे हो? How are you doing? So I'm just waiting for more students to join in and then we will start because today's chapter is very interesting and fine. Okay, great. Good. Welcome, beta. Welcome to the class. And I'm just waiting for others also to join in. Today's class is very interesting. Of course, this is psychology class 12 and we are going to speak about the psychological disorders, the part 1 of the chapter because ये बहुत बड़ा chapter है और इसे cover करने के लिए बहुत ही we have to take good time to cover the chapter because of course this is a very important chapter also and it is very interesting chapter also. It's actually one of my favorite what do you call chapters among the entire book. So I'm just waiting for everybody to join in. ओके जब तक के सब लोग आ रहे हैं मैं क्विकली प्लस के फीचर्स बता देती हूँ ऑल्दो आई नो दैट यू गाइज आर अवेयर बट like I always do, and it's my job to tell you guys again and again that yes, we are going to have some beautiful features. Before that, whenever you want to subscribe, you can use my referral code. That's Urmi Live. मैम अभी एक सॉन्ग प्ले कर दीजिए. सॉन्ग प्ले कर दूँ वो कैसे हो पाएगा? क्लास के बीच में कहाँ ही सॉन्ग आ जाएगा भाई. चलो सो क्विकली लेट मी जस्ट टेल यू एज यू कैन सी द फिगर. तो मैं ये तो समझ में आ गया होगा कि दिस इज़ अ वेरी इंटरेस्टिंग चैप्टर. साइकोलॉजी में हम बहुत सारी चीज़ें इस पे बात करेंगे अबाउट एंग्जाइटी, बाइपोलर, बीइंग बाइपोलर, हैविंग डिप्रेशन एज अ मेन फैक्टर, हैविंग स्किज़ोफ्रेनिया पेशेंट्स, all these things. Okay, before that, psychological disorders क्या है और हम इस चैप्टर में क्या क्या पढ़ेंगे, before telling you the features. Okay, let me just quickly tell you that we are going to understand the basic issues in abnormal behavior, the criteria which is used, also the criteria which is used to identify, okay, basically trace such behaviors in human beings. We are going to appreciate the factors which cause abnormal behaviors. We are going to explain the different models of abnormal behavior and describe the major psychological disorders. तो ये जो functions तुम्हें यहाँ pictures में दिख रहे हैं ना, ये सारे की सारे चीज़ें हम इसमें बात करने वाले हैं. This chapter is basically very interesting, of course, because it is mostly about the disorders people come across and people feel or see or go through. Okay, now yes, there are also the part and parcel how you can say that people. Ma'am, second chapter 11th का हो गया है क्या? सेकेंड चैप्टर 11th का बेटे कुछ कुछ चैप्टर्स हमने किए हैं. ओके, 11th के एक बार आप यूट्यूब में ह्यूमैनिटीज़ वाले चैनल पे एक और बार देख लो कि हमने कौन से कवर किए हैं. ठीक है, आई एम श्योर कि हुआ होगा, बट आई एम ऑल्सो गोइंग टू रिपीट इट बिकॉज सबके एग्जाम्स चल रहे हैं. तो मैंने स्पेशल क्लासेस में भी बोला है कि मैं स्पेशल क्लास भी लूँगी चैप्टर वाइज, बिकॉज ऑफकोर्स रिविजन हो जाएगा. ठीक है, सो इफ़ यू हैव एनी प्रॉब्लम्स यू कैन लेट मी नो, नो प्रॉब्लम. ठीक है, I'll answer you and चलो शुरू करते हैं without any delay. My name is Professor Urmi Chakravarti. Okay, many of you know me, most of you, even if you there's someone who doesn't know me, I welcome you all. Uh, okay, all right. Okay, all right, Pingu. Thank you so much. That is so sweet of you. I'm glad that you know me, and I'm very happy to see this. That okay. मैम सॉन्ग प्ले कर दीजिए. नो शुभम, क्लास के बीच में तुम तो फंसा ही दोगे. चलो, सो दिस इज अ लिटिल अबाउट मी. अब मैं क्विकली एकदम जिस्ट में तुम्हें बता देती हूँ सम फैबुलस स्पीक व्हाट यू कॉल फीचर्स ऑफ प्लस plans which if you have not taken yet. Okay, there are unlimited access to all the courses, of course not just 11 12, but we have come up with different courses, different varieties. There are going to be exhaustive coverage of syllabus, and as you can see मैंने अभी भी बोला कि हमारे जो भी chapters हुए हैं हम उसको भी रिपीट करने वाले हैं बिकॉज ऑफ कोर्स एग्ज़ाम स्टार्ट हो गए हैं. सो मुझे पता है एंड वी आर अवेयर कि एग्जाम्स में इंपॉर्टेंट क्वेश्चंस आएंगी. वी आर गोइंग टू गिव यू द स्टडी मटेरियल विच इज़ इन PDF फॉर्म विच इज़ वेरी फॉर्मेट विच इज़ हेल्पफुल. आंसर राइटिंग सेशंस बिकॉज ऑफ कोर्स बहुत बच्चों के डाउट्स भी रहते हैं कि मैम ये क्वेश्चन 4 मार्क्स का आएगा कि 3 मार्क्स का आएगा. एंड ऑफ कोर्स there are some top educators and the brilliant minds which an academy has brought together. Okay, including all of us who have come from different backgrounds with different expertise to help you all in order to fetch great marks which will really help you to score well. Okay, we are going to have daily practice sections which we have mock tests which are going on. We have yesterday was maths, today was English. All the days we are bringing up something or the other to you, and you can see all of that on the Telegram groups. You can see all of that on the Unacademy app, the features, the learning features. It is already given to you and it is very helpful for you to go ahead and watch the schedules कि कौन से दिन क्या क्या है और कौन से टीचर्स कौन सा सब्जेक्ट लेने वाले हैं. सारी की सारी चीज़ें दी हुई है. Alright, I'm hoping that it's going to help you very well. So the Science and Commerce complete syllabus is already on. Batches for 2021 is already there. Okay, JW का सब्सक्रिप्शन लिए हैं. All right, okay, very nice. ठीक है, science commerce batches are already, the syllabus complete batches are there, and the best part is the NCERT weekend batches, which is the cherry on the top. That is, even on the Saturdays and the Sundays there are the educators who are helping you, and different timings are given. If you can see English, business studies, accounts, economics, you already see that there's chemistry, maths, bio, physics, everything, all the different subjects are there. You just say it, you name it, and it's already there. Okay, the live interaction is given. These features you will always see across all the batches of an academy, especially the new batches which are being launched in the terms and in the new terms and aspects of the humanities, because of course humanity is now on plus, and you have all the subjects, that's political science, you have history, you have geography, economics, sociology, psychology, English, and the most opted optional subjects also, that's psychology, that's physical education, IP, Hindi. All these things are there. Okay, so if there's anything which you're missing out, you have to just go ahead, look at the app and subscribe. Okay, now best part is that you can use my referral code, that's URMI Urmi Live, and get a 10% discount on the same. There are top educators, there are featured educators, and as you can see, I already told you that I'm taking psychology and sociology both. So if you would like to study from me, by me, I welcome you on board. So come join us and then just learn well. I'm hoping that it is going to help you really well. Okay, not just this, the next thing which I would like to tell you here is the referral code, how to use it. Okay, you put this referral code on this place and you get a straight away 10% discount. Okay, this is just for your micro. Okay, all right, great, thank you. And also the best part is we have started with class 6 to 8 also. So this is the new thing which we have launched. So Learn with an Academy CBSE is now very easy, and just let's crack it. So there are different plans right from 1 month to 73 months. Okay. The 7 to 12 subscription which is different, from 6 to 12 that is different, and from 8 to 12 the subscriptions are different. So please go ahead, watch out for the different plans, use the referral code and just get going. Okay, is it clear? Do we start with the chapter? Do we start with what exactly are psychological disorders, and let's learn something new? Do we start? Okay, so everyone says yes, ma'am. All right, then let's just begin. The study of psychological disorders, okay, has intrigued and mystified all cultures more than 2500 years. Okay, psychological disorders or the mental disorders. Okay, please remember that either it is known as psychological disorders or it is also known as mental disorders, as they were commonly referred to, like anything which is unusual, okay, that make us very uncomfortable, or it is kind of getting us a little frightened. Okay, you basically have nervousness, you basically get frightened. Why these things happen? How does these things happen? Anything which is unhappiness, anything which is a discomfort, anything which comes under anxiety, anxiousness, okay, unrealized potential, they are all seen over the world. These failures in living, okay, are due to mainly the failures in adaptation to life challenges. Now, as you must have studied in the previous chapters, of course, before the ones which we have studied the variations and the attributes. Adaptation refers to the personal ability to modify his or her behavior in response to the changing environment requirements. Okay. Now, there are certain changes which all of us come across in day to day lives. Similarly, when I talk about the term changes, okay, in behavior in response to changing environmental requirements, please remember that this is one aspect where and how, a person's ability basically to change, okay, are mainly due to the adaptation of life changes which he or she comes across. When the behavior cannot be modified according to the needs of the situation, it is told to be the maladaptive, way. Abnormal psychology is the area, okay, abnormal psychology is the area within psychology that is more focused on the maladaptive behavior, its causes, consequences and treatment. There are three things, okay, that's causes. Okay, let's see what are its causes, its consequences and its treatment. So causes are what, that why is it happening. Causes का meaning क्या है? Causes are basically Why does it happen? Okay. Consequences are what is going to happen next after this. Okay. Treatment is, of course, to get treated, you need to have a treatment. Otherwise, if you don't take up a treatment, how will you cure yourself? So, all these three factors are very important when we are speaking about a behavior which can be modified according to the need of the situation which is being created. First, now, there are different concepts of abnormality and psychological disorders. What exactly do you mean by uh, abnormality as a term? We all know that something which is not very normal, something which is not normal, okay, something which is odd, something which is not okay is called as being abnormal. Although many definitions of abnormality has been used over the years, none of them has won an universal acceptance. Still, most definitions have certain common features which are often called with the 4Ds. Okay, what are they? Deviance, distress, dysfunction, and danger. What are the four? Deviance, distress, dysfunction, and the danger. Okay, these are the common features of abnormality. These are the common features of abnormality. That is, psychological disorders are deviant, that is different. Deviant matlab that is different, which is extreme, something which is unusual, bizarre, not really quite good, something which is very uncertain or something which is an unexpected thing, different, or very upsetting to the person or to others. For example, there is something which is being done by this person, it's kind of upsetting to others. Okay, this definition is a useful starting point on which we explore psychological abnormality. Since the word abnormal literally means away from normal, it implies deviation in some clearly defined terms or norms or standards. In psychology, we have no ideal model, okay, or no normal model of human behavior to use as the base for comparison between the two. Various approaches have been used in distinguishing between normal and abnormal behaviors. From these approaches, these basically emerge two on the conflicting views. Now, what do you mean by the conflicting views? Conflicting means that your opinions are not the same. Okay, you're differing. How do you differ? Either you say that no, I don't agree, or you say okay, I agree. This is something which I believe. There is a difference of opinion. There can be a hesitant fight. There can be a difference of thought process. This terminology is known as conflict. So it's a simple term. Various approaches have been used in distinguishing between the normal and the abnormal behaviors. How will you understand if the person is normal? How will you understand if the person is not normal? Right? You need to understand the difference between normal and abnormal, right? Without that, how will you be able to, even define the two types of normal and abnormal, the behavior? And from these approaches, you lead and reach to two basic and conflicting views. The first approach views abnormal behavior as a deviation from social norms. What is deviation? Again, it's kind of different, okay? Different from the social norms, okay? Yes, ma'am. All right. So I'm hoping that you're understanding. Deviation? Yes. Okay. Hello, Opula. Good evening. All right. So when I say that various approaches have been in distinguishing between normal and abnormal behaviors, from these approaches there are two basic conflicting views in which the first one approaches the abnormal behavior as deviation which is different from social. Of course, it's different. It's unique. It's something which is not very usual. Okay. Hi, Opula. Hello, Aman. Very good afternoon, both of you. How are you doing? Okay. Hello, hello, hello. Both of you, welcome, welcome. Hi, Sanjana. Hello. Chalo, great. So all of you are almost here. I can see most of you have joined. Very good. So don't be late for the class because even the first slide is important with the figure whichever I show you. And of course, as you all have understood that today we are doing the chapter of psychological disorders, part one of that chapter because it's a huge lengthy chapter. We would be splitting into two parts. So the next class which I'm going to take is of course of the part two. All right. Okay. Many psychologists have stated that abnormal is simply a label which is given to a behavior which is kind of different. Okay, of course, please remember whenever you listen to the term deviant, of course, that this is that it's just different. Okay, it is different from the social expectations. Like you expect a person to be the way we all are with each other. Now, that is not a possibility when we speak about an abnormal behavior or thoughts and emotions which are, which differ. They are markedly from a society's ideas of proper functioning. Okay, each society has some norms. Again, when we speak about the term norms, we here tend to believe that this is something of rules and regulation. Okay, these are rules and regulation. These are uh, aspects which we need to remember. Okay, which are stated or unstated rules of proper conduct. Okay, of behavior. This is behavior. You cannot behave in a different way when you are in front of other four people. It's an interesting and important fact. Behavior, thoughts, emotions, that they break the societal norms, which are called abnormal. A society's norms grow into its particular culture, its history. A society's norms, they grow from a particular culture, its history. Why? Because everything we learn is coming from the history only, no? The change we all are evolving in is also coming from history only. So that's an important part and parcel of our lives. A society's norms grow from its particular culture, history, value, institutions, habits, skills, technology, and arts. Thus, a society whose culture values competition and assertiveness may accept agree what do you call aggressive behavior, whereas one that emphasizes cooperation and family values, such as in India. Okay. Now they all may consider aggressive behavior which is unacceptable. That if you're very angry, if you cannot tolerate something, if you just are very anxious towards something, nobody can take it. It's not normal. Serious questions have been raised out about this definition. That why and what is the reason that people behave like this and what can be done to control it. And it is based on an assumption that which is socially accepted behavior which is not abnormal. And that normality is nothing more than the conformity to social norms. That is nothing but the social conformity to social norms. Is this slide clear? Any doubts by far? Can anybody let me know? Any questions still here? Okay, clear? All right, ठीक है. Please reply a little early so that I can continue because I usually wait for any of you to reply and then only I proceed. But great, if it's clear, let's just move to the next one. Second approach view of the abnormal behavior is being a maladaptive behavior. Okay, many psychologists believe that the best criteria of determining the normality of behavior is not whether the society accepts it or whether it fosters the well-being of individual or eventually of the group to which she belongs. Well-being is not simply maintenance and survival but also includes growth and fulfillment, which is true. It's the actualization of potential which you must have studied in Maslow's need of hierarchy theory. You remember the model in which he told you the hierarchy of needs which Maslow has given, in which he has given about the shelter, food, clothing, everything, the theory, entire theory is given. Yeah, similarly. Okay, you remember? Yes, correct. And hence, according to this criteria, conforming behavior, which can be seen as very normal, very abnormal, if it is maladaptive, if it interferes the optimal functioning of the growth. Now, growth and development is something which goes hand in hand. Okay, that goes hand in hand, and which is very important. For example, a student in a class prefers to remain silent when he or she has questions in mind. Why? He's kind of not adjusted or comfortable with the environment to raise his hand and say, "Ma'am, I have a question." Describing behavior as maladaptive implies that a problem somewhere or the other exists. It also suggests the vulnerability in an individual and inability to cope up, or exceptional stress in the environment, which has basically led to many problems in life. Of course, if a student is not happy, if the student is not confident, that means there is some definite problem that kid is facing, no? Otherwise, why he or she will not try to answer or raise his or her hands? If you talk to people around you, you will see that they have vague ideas about psychological disorders. Sometimes they say it is superstition. कि okay नहीं उनको नजर लगा है इसीलिए शायद हो सकता है. They think that science cannot be an important factor. They are ashamed of this thing to share this thing. They feel that okay, no, this is something which we should not talk about. It's a normal phenomena. Many people have it, many people don't. It's commonly believed a psychological disorder is something to be ashamed of. Okay. Why? That is the taboo, that is the myth we all need to together break, for the people who are studying, for the people who are interested, the people who are, who have their fortes as psychology. who wants to grow. The stigma attached to mental illness means that people are hesitant to consult a doctor or a psychologist because they're ashamed of their problems. Okay? They don't want to share things with them. They feel that sharing their problems with someone else will not look good. But why? They probably can just help you out, right? And similarly, this is the reason why they are saying in the example that people are ashamed of it. Actually, psychological disorders which indicates a failure in adaptation should be viewed as any other illness. Of course, why? Only then it can be only then it can be tried to be treated. Okay, whether it takes time or whether not, at least it can be treated, right? Any questions still here? Okay, let me just give you a historical background of the same. Okay, that how do you understand the psychological conditions? The historical background to understand psychological disorders, we would require a brief historical account on how these disorders have been viewed over the ages, like previously, before we even can speak about it. Previously, how were they talked about? How did they come into picture? And when we have studied the history of abnormal psychology, we have also found that certain theories have occurred over and over again. Like it has repeatedly come one after the other. And one ancient theory that is still encountered today holds that abnormal behavior can be explained by the operation of supernatural and magical forces, such as evil spirits, that's Bhoot Pret, and the devil, that is Shaitan. Why do I say this? Operation of supernatural and magical forces? Because this is being explained in our ancient theories. So, the historical background we are speaking about here, Bhoot Pret is a part and parcel of it. And not just those times, okay? Even now, there are people who believe that this is the reason that people have, issues, or they are facing some problems going through certain patches of life. Next is exorcism. Now, that is removing the evil that resides in the individual through counter magic and prayers, which is still commonly used. In many societies, the shaman or the medicine, okay, basically, Ojha, is a person who is believed to have contact with supernatural forces, and that is the medium through which spirits communicate with human beings, tantric, ojhas. And through the shamans, yeah, an afflicted person can learn which spirits are responsible for his or her problems and what needs to be done to appease them, to make them comfortable, to get them rid of the issues, etc. A recurring theme in the history of abnormal psychology is the belief that individuals behave strangely because their bodies and the brains are not working properly. This is the biological and organic approach. In the modern era, there is evidence that body and brain processes have been linked to many types of maladaptive behavior. For certain types of disorders, correcting these defective biological processes, the results in improved functioning. This is being proven. Of course, it's a theme which is recurring, and it's an individual belief which we have seen, which we've come across, which we're facing. Exactly, historically, past, present, and future, all the three of them. But yeah, for certain types of disorders, correcting these defective biological processes they result into improved functioning. That people can, for example, if they have some issue and it is being treated properly, of course, there has to be a positive side also if they have been treated properly. Another approach is the psychological approach. This is the most important one. Now, according to this point of view, psychological problems are caused by inadequacies in the way individuals think, feel, perceive in the world. All three of these perspectives, that is supernatural, biological, or organic or psychological, have recurred throughout the history of Western civilization. In the ancient Western world, it was a philosopher, physicians of an ancient Greece such as Hippocrates, Socrates, and in particular Plato, who developed the organismic approach and viewed disturbed behavior as arising out of the conflicts between emotion and the reason. Okay, simple term. This you will not find it very difficult. Very simply, they have explained. Then Galen also elaborated the role of four humors in personal character and temperament. Of course, humor, four humors in personal control of your emotions and the temperament which you have. According to him, the material world was made up by the four elements. Now, this is very important and very easy also because we all know the different elements which we have: earth, air, fire, water, which are also the four forms of essentials. Essentials what? The body fluids, blood, black bile, yellow bile, fat. Now these are very important. What are these? We are going to study in the upcoming slides. Each of these fluids was seen to be responsible for a different temperament. Okay, the temperaments can be usually leveled. It can have different levels. Okay, temperament can have different levels. Imbalances among the humors were believed to cause the various disorders. Of course, they were the reasons why it was believed to cause different disorders in people simultaneously. There were changes, there were apparently times which was changing from ancient to medieval, from the middle. So, what they are trying to say here, during the early Middle Ages, the Christian spirit of charity prevailed, and St. Augustine wrote extensively about feelings, mental anguish, and conflict. This laid the groundwork for modern psychodynamic theories of abnormal behavior. Of abnormal behavior. Okay. Are there any questions still here? Ma'am, don't use highlighter. Reading is problem then. Okay, all right. Thank you. Won't. Okay, all right. Okay, okay. Now, during the early Middle Ages, like I told you, that this basically led to the groundwork of modern psychodynamic theories of abnormal behaviors, because slowly and steadily they started moving and growing. Okay, the Renaissance period, which was marked by the increased humanism and the curiosity about behavior. Okay, now you will think that, ma'am, how come psychology is now here linked with suddenly sociology? Because we are going to study about the 17th and 18th century, which were known as the age of reason and enlightenment. Okay, so yes, John Weir emphasized psychological conflict and disturbed interpersonal relationships as causes of psychological disorders. He also insisted that witches were mainly disturbed by the required and medical or not theological treatment. Of course, this was common sense, that witches were mentally disturbed and required medical but not theological treatment, because they had proven that if they were treated properly and with accuracy, It was changing and the times were working to be better. The growth of scientific attitudes towards psychological disorders in the 18th century contributed to the reform movements and then increased comparison of people who suffered from these disorders, reforms of asylums, which were initiated in both Europe and America. One aspect of the reform movement, which was new to the inclination or deinstitutionalization, which were placed, okay, emphasis on providing community care for recovered, the mentally ill individuals. And of course, in the recent years, there has been a convergence of these approaches, okay, which has resulted in an interactional or a what do you call, biopsychosocial approach. For example, with this perspective, you can say all the three factors, that's biological, psychological, and social, they play a very important role in influencing the expression and outcome of the psychological disorders. Okay, if that person is really facing an issue and there are people who are around him trying to, demoralize, demotivate, speak more about that, you know, phase or pact or the patch, then there are different expressions of the psychological disorders which come in front, which are the influencing factors. Okay, is this clear? Do we move ahead? Have you understood till here? See, I really know that this is a very what do you call, lengthy unit, and hence I have divided into two parts. So if you have any questions till now, you can ask me. Okay, Sanjana, Opula, Shubham, Aman, any questions, beta? Clear? Okay. Classification of psychological disorders क्या होता है? Now this is of course another major important thing. In order to understand psychological disorders, we need to begin by classifying them. See, to understand any problem, okay, if we do not know what is the reason, okay, if we do not know why are we doing it, okay, how will we even understand? Okay, clear, ma'am. Okay, all right. ठीक है. In order to understand the psychological disorders, we need to begin by classifying them. Okay. Now, a classification of such a disorder or such disorders basically, they consist of a list of categories of specific psychological disorders. They are grouped into various classes on the basis of some shared characteristics, okay, like which are common, sometimes which are matching. Classifications are useful, of course, because they enable users like psychologists, psychiatrists, and social workers to communicate with each other about the disorders and help in understanding the causes of psychological disorders and process which are involved, okay, sorry, and processes which are involved in their development and maintenance. We need to understand that why these things are happening. And only for this thing, classification is required. Without that, it is not possible. You cannot understand certain things if there is no classification which is being explained properly. And hence, it is already mentioned here, the American Psychiatric Association, as the APA, has published an official, manual describing and classifying various types of psychological disorders. Okay. The current version of it is Diagnostic and Statistical Manual of Mental Disorders. That's fourth edition of DSM-4, that evaluates the patient of 5 axes or dimensions rather than just one broad aspect of mental disorders. These dimensions relate to biological, psychological, social, of course, emotional, and other aspects. All of them, whatever we have discussed, whatever we have studied, all of them. The classification scheme officially used in India and elsewhere in the 10th revision of the International Classification Disease, that's ICD 10, which is also known as ICD 10 Classification of Behavioral and Mental Disorders. It was prepared by the WHO, that is the World Health Organization. For each disorders, a descriptive of the main clinical features or symptoms, okay, and of the other associate features, including diagnostic guidelines, is provided in the scheme. This is just for you to know. This is an important part of information NCERT has given you to know. That what are the ways that they have, the WHO has figured out to explain what exactly psychological disorders are and what are the components of the same. Factors underlying abnormal behavior. Okay, now what is it? Okay, I know there are a few slides, but there are 3-4 slides left. So I understand that this is kind of heavy, but we will just do a few, and I'm going to keep the rest of them for the next part, because yes, this chapter again, it's a lengthy chapter. If you don't understand slowly and if you don't read it properly, you will not understand it. Okay. Factors underlying abnormal behavior. In order to understand something which is complex or abnormal, psychologists use a different approach. Each approach in use today emphasizes a different aspect of the human behavior, and it explains you and treats the abnormality in line with the respect. These approaches also emphasize the role on different factors such as biological, psychological, interpersonal. You have to remember all these terms, okay? Now, these are the factors which on a long run are the same everywhere. You call it social, so in sociology or in psychology or in history or economics, everywhere. These are the common factors, such as biological, that's of course psychological, interpersonal, and socio-cultural, something which is around you, surrounding you. We will examine some of the approaches which are currently being used to explain what exactly abnormal behavior is. Okay, biological factors kya hai? Whatever is influencing the aspect of your behavior. Okay, a wide range of biological factors such as faulty genes, endocrine imbalances, malnutrition, injuries, and other conditions may interfere with normal development and functioning of the human body. Adapting. These factors may be potential causes of abnormal behavior, and we have already come across the biological model. According to this model, abnormal behavior has biochemical and physiological basis. Biological researchers have found that psychological disorders are often related to the problem's transmission of messages from neuron to another. देखो, biological aspects क्या क्या है? भाई human conditions में, human body में बहुत सारी ऐसे changes आते हैं which keeps on changing and which they're different from one to another. एक नहीं होता, they're not limited to one, and there are different potential causes for these. So even for the reason of being abnormal, or even if there's a concept of abnormal behavior, we have come across the biological model. According to this model, abnormal behavior is nothing but the component of biochemical and physiological basis. Biological researchers have found that psychological disorders are often related to the problems in transmissions of the messages of neuron from one to another. Now, neurons play a very important role in the field of human psychology as well as medical science when we respect to study about your body, mind, thoughts, everything. You have studied in class 11 that the tiny space which is called synapse separates the neuron from the next, and the message must move to that space, across that space. When an electrical impulse reaches a neuron's ending, the nerve ending is stipulated to release a chemical which is called as a neurotransmitter. See, very clearly it's mentioned. Class 11, the chapter of the basis of human behavior, if I'm not wrong. You've already studied this and that. Neuron, endocrine system, the thyroid glands, the pituitary glands, all these things we have already studied. Same, same. Studies indicate that abnormal activity by certain neurotransmitters can lead to specific psychological disorders. Anxiety disorders have been linked to low activity of the neurotransmitter gamma aminobutyric acid, that's GABA, that's GABA. Schizophrenia to access the activity of dopamine, and depression or the low activity of serotonin. Okay, is this clear? Clear, ma'am. It's tough, ma'am. It's not tough, beta. In case you understand the meaning, in case you understand the definition or the main words which are being used to describe it. Like for example, ki bhai, what is GABA? You need to understand it is nothing but the gamma aminobutyric acid. Okay, this is usually there and prevalent in these kind of people, which is helping. So studies are indicating that abnormal behavior, behavioral activities are certain neurotransmitters which are leading to specific disorders or access of activities of all these drugs. Okay, which causes depression, which causes you the activities which are not very normal or unique, and hence we call it as very, of course, deviant. Okay, speaking about the genetic factors, how they have been linked to mood disorders. Now, yesterday, even in the previous class, not the yesterday's class, even in the previous week's class, I told you that how hormones play a very important role in the dysfunctional activities or, a human mind, body, thought, mind, soul, everything. It will help you to balance. It will certainly help you to even imbalance things, sorry. So, yes, although there is a sound evidence to believe that genetic biochemical factors are involved in mental disorders such as schizophrenia, depression, anxiety, or you can etc. You can say biology alone cannot count the most, mental disorders. You have to have these factors also. Okay, and without it, it is not possible. Several psychological models which provide a psychological explanation to what mental disorders are. We always think that mental disorder matlab that man is mad, that person has some issues. What is the issue? Why is the issue happening? What are the classifications? What are the general factors, the what do you call, reasons behind it? There are different genetic factors which are being linked to mood, psychological disorders, hormone imbalance, um, mental retardations. Sometimes, okay, sometimes any one of the parent who is suffering from cancer, let's take an example. Okay, imagine that one of the parent who is suffering from cancer undergoes radiations or undergoes, for example, if the mother is carrying a baby and if the father is undergoing a chemotherapy going on, that is also going to basically somewhere or the other impact the lady's pregnancy, and there can be a disorder, there can be a mental retardation in the baby. Now, this is pure science. But yes, psychology is a very much part of parcel of the science stream, and you need to understand that why these things happen. Faulty genes, even amongst both the parents, even if one has some of the genes which are faulty, it will definitely lead to a mental retardedness. It will definitely lead to what do you call severe evidence of being mentally disturbed, the dysfunctionalities. They can have maternal deprivations. And the psychological models which are basically used, included, or includes what we can say, the psychodynamic, behavioral, cognitive, humanistic, extensional models. The psychodynamic model is the oldest and the most famous of the modern psychological models. But there are many others also, including psychodynamic, behavioral, cognitive, humanistic, essential models. Now, is this clear till here? Pingu says clear question mark. Okay, it's not clear. Should I repeat it again? Uh, Please tell me if I can repeat it for you and I'll repeat it. No problems. Okay, ma'am, समझ गया. All right. Okay, great. Chalo, then let me just quickly sum it up for today. Okay. Uh, Next class, basically, we are remaining with two things, but we are going to start from the major psychological disorders, okay, which is the third component, which will include stressors, factors that are going to lead into psychopathology, okay, which is kind of, we say that if there is a risk, if the persons are exposed to these stressors, then their predisposition may actually involve into a disorder. Can you see this? And we are going to discuss this, that how and why does this happen. Okay. And I'm hoping that I see you all in the next class. But meanwhile, once again, like you all know, the amazing features which Plus is giving. Once again, this is my referral code. If you would like to come ahead, watch the recorded sessions, which are special classes, they are all for free. So come make an account on Unacademy, the learning app. Witness all the classes, the special classes, okay? And if you understand things and if you're okay with it, please join us on Plus. And we promise you and assure you that you will have really good marks. Of course, I know psychology being an optional subject, but for class 12th people, they usually find it very difficult to find exact place to go and learn. Of course, because it's an elective. But yeah, as you are sure and you're knowing that NCERT has probably, the CBSE boards have already tentatively given a Feb date for the boards, so we don't have much time. And if this is the right time to join the classes and just get going, don't lose your time. So, yeah, thank you so much. And please feel free to ask if any questions. I'm here. And yes, also, meanwhile, like I always tell in all my classes, all of you, Stay safe, and my regards to your parents. Take care of yourselves. I'm hoping to see you all soon in the next class. Okay, Pingu says thanks a lot, ma'am. Samajh gaya. Okay, all right. Aman says, ma'am, how I scored in chemistry. Ma'am, how I scored in PCM. NCRT is enough. Yes, beta, NCRT is enough. Um, but if you really want ki, like for example, if I am taking the classes, I usually take it from NCRT, okay, and I give you the examples which I give you, of course, is the experiential examples which we come across. In sociology, we have many things which to see and adapt from different reference books. Okay. In psychology, if you ask me, similarly, I give you many examples which are practical. So I'm sure that even for your chemistry and other subjects also, if you basically come across a good educator for these subjects, which I'm sure is available online, go ahead and watch some of their special classes where there are different people, people who are taking for chemistry, for physics, for of course biology. So come on board, have a look at them, and then decide that whichever is best, just go with it. Yeah. So once again, thank you all. I hope I could answer, Aman. And yes, to all of you who are looking at it and who are watching this video, once again, this is my referral code. That's Urmi Life. So please take this for to get in avail a 10% off on the subscription wherever you take. All right. So yes, thank you for today. And ma'am, I want to become a psychologist. So, which subjects I can get after 12th, please? Okay. So, basically, you can do humanities. You can do your graduation with psychology. And right now, which class are you in? If you're in 11th, then you can take like psychology. If you're in 12th, that means you've already done it. If you've already taken psychology, then yes, try to score good marks in class 12th. You can have the PCM combinations also. Psychology is an optional subject for the science students. Okay. For the humanities students, of course, they have other subjects with this. But post your class 12, you can elect for one. You can basically do your majors. Okay. And this is going to be very helpful to you. Okay. So I'm hoping that this helps you, Aman. And you can join for my special classes and you can ask these questions there. I'm sure I will be able to help you there as well. Yeah. So, all right, take care, all of you. Thank you, ma'am. You're solving my doubts. You're most welcome, Aman. I'm here to help you, and please ask whatever you want, whatever you need. I'm there to help you. Come join my you on the same descriptive channel here under the name. My profile for an academy is given. Go there, join it, join the classes which I have already taken for psychology. Okay, and then yes, I welcome you once again to join me for a future learning and fabulous endeavor with me. All right. So thank you. Take care, all of you. Stay safe. And this is Professor Urmi Chakravarti signing out. Bye bye, guys.